starting the company about 18 years ago. I'm a recovering computer science engineer by training, and my training in US healthcare began in 2001. And ever since I've been in healthcare. And the genesis of this business is really in the realization of the scale and the amount of inefficiency in US healthcare. So, we all talk about, obviously, we're proud Indians of India's GDP story. We're on our way to becoming the third largest economy in the world. We probably have the best political dispensation in the world with a visionary leader like Modi ji. And all that makes for such an exciting opportunity set as it relates to the India story. What is it, $3 to $3.5 trillion growing in real terms at 7%? Well, very interestingly, US healthcare is a very interesting story. It's about $4.8 trillion. It's the largest industry in the world. Also growing at 7% in real terms with absolutely no cyclicality. Why so? Because the population in the US is aging. As that population is aging and people are getting wealthier, lifestyles are becoming more and more sedentary, because of which there is a greater and greater prevalence of chronic lifestyle disease, diabetes, COPD, congestive heart failure. That's because of all that, the number of patients keeps growing without any cyclicality. And that is also creating a very, very interesting situation where the number of patients actually is growing faster than the number of providers, doctors, nurses to provide the care. And so actually, our simple thinking for US healthcare was, where is there a $4.8 trillion industry that lives in the temple of capitalism? I call America the temple of capitalism. And capitalism stands on the two pillars of efficiency, technology and globalization. Those are the two fundamental pillars of efficiency that capitalism stands on. And yet, the largest industry in the temple of capitalism, which is the US healthcare provider industry, has not leveraged these two pillars of efficiency. And our simple thinking was to bring the effective combination of these two pillars, technology and globalization, to this largest industry, US healthcare. Now, when we looked at the US healthcare provider ecosystem, if you really think about it, it's a sort of a 4P ecosystem. One, there's patients that need care, right? Then when it comes to businesses, there are providers that provide for the care, which is hospitals, doctor groups, etc. There's payers that pay for the care. And then there's pharma companies that provide drug therapies, right? That's the 4P ecosystem. Of that 4P ecosystem, we decided to focus on the provider part, which is that $4.8 trillion, is the provider part. Now, within the provider part, we had to figure out where within the provider part we focus, because it's like saying, I'm going to build a business focused on Indian economy. Well, which part of Indian economy are you going to focus on? So we had to figure out which part of the provider ecosystem we are going to focus on. And to understand that, we had to study what was going on in the provider industry. And what was going on was this perfect storm of cost, quality, and access. Why do I call it the perfect storm of cost, quality, access? First, the cost of healthcare at $4.8 trillion is nearly 20% of America's GDP, which is more than what any other advanced economy in the world spends on healthcare, and yet their outcomes are inferior to most other economies. So you have spending 20% of GDP, it's growing at 7% faster than GDP in a highly budget deficit economy, which means you have a real cost problem, right? Second, you have an access to care problem where today new patient wait times for doctors are as high as 45 to 60 days for primary care and really 6 to 9 months for specialty care. So you have a cost problem, you have an access to care problem, and now you have a quality of care problem as well, which is being driven by this phenomena called regulation-driven administrative burdens. Providers in the US are now being burdened by a whole bunch of administrative tasks that are being created by regulators. And US healthcare is highly regulated. Statistics are doctors and nurses are spending more than 50% of their time on non-patient care, non-discretionary tasks. Does that make any sense? In a world where they have to take care of more and more patients, they're spending more than 50% of their time on non-patient care, non-discretionary tasks, leading to this phenomenon called administrative burnout that is creating quality errors. And today the statistics are number of deaths due to medical errors in the US 150,000 a year. So when there is such a perfect storm like cost, quality, access brewing, we saw that one way to overcome this storm would be the transformation of care delivery from a hospital-centric care delivery system to a physician office-oriented care delivery system where physicians would start taking proactive care of patients. In a hospital, remember, the care delivery is very reactive. You go to a hospital when you're already sick. In a chronic lifestyle disease world, if you operate in such a system, the ability to bend cost of care and improve quality of care is severely compromised. So we realized that it would move to a proactive physician-led care delivery system, and the most important point of care would become the physician's clinic or the physician's office. And as that becomes the most important point of care, we decided to build our business focused on that market. Now that market in the US was about a $1.5 trillion market, which we call the physician clinic in India, the middle and back office. And we applied two simple lenses. We said, if there is a task that need not be done in the clinic, that means it might be a chore that we can delegate. And if there's a task that need not be done by the physician or the nurse or the clinical team, that might be a chore that we might be able to delegate. So that gave us a whole bunch of possible chores. Then we applied the next set of lenses, which was which of these chores can we do better, cheaper, faster at scale, leveraging those two pillars of efficiency that we would leverage. What were those two pillars? Technology and globalization. Why technology? Because I'm a technologist by training. First instinct was we totally eliminate the task by writing proprietary technology or product. But because we are also pragmatic technologists, we realize that even with the most modern manifests of technology, Gen AI, deep learning, cognitive robotics process automation, often you can't totally eliminate the task. You still need some human in the loop to complete the task effectively, and especially because this is healthcare, to complete the task safely. Because machines have their own biases, machines can have hallucinations. Gen AI, we are all known, is straddled with hallucinations. And so as a result, you had to combine the technology with humans. There was just not enough humans left in the US to do this work. So the only way to scale the human part was to leverage the global outsourcing model. So we said we'd leverage the global humans in India, combine them with proprietary technology to take away all these tasks so that these providers could focus on their core task of taking care of patients. And so when we applied all these lenses, what came out was this continuum of about 16 tasks, which essentially get created, 16 chore tasks that get created along the patient's journey, with $225 billion a year is being spent on these tasks being done mostly by people in-house in these large physician businesses, right? And just to put that in perspective, you all know of the large industry in India called the Indian offshore software services industry, right? IT services outsourcing industry. What is the size of that industry? It's about $250 billion. So we had found a TAM, a total addressable market, that's nearly the size of the entire Indian IT services outsourcing industry that was growing at 7%. That was an addressable market for us. The other thing we realized is of this $225 billion, only $30 billion have been outsourced so far. So it was a highly under-penetrated market, which created a massive growth opportunity. And we actually learned that the outsourced TAM, which is about this $30 to $35 billion, was growing at nearly 12%. So that created a massive opportunity. And we decided to actually go about building this business. There were 2 or 3 very important aspects of how we built this business that are important to understand. First, what was our value prop? Our value prop was, Miss Customer, it is costing you 15% of your revenue to do these tasks. We will do them at 10%, give or take. That means you're saving 500 bips as a percentage of revenue in cost. Second, by taking away all these tasks, we are freeing up nearly 2 to 3 hours a day for the doctors and nurses. As we free up their time, they're able to take that time back and see more patients, create more revenue in the same fixed cost, which means their revenue would go up by nearly 500 basis points. Cost comes down by 500 basis points, means the total value is 1,000 basis points as a percentage of revenue. There were barely 10% EBITDA businesses. You had 1,000 basis points, means you're nearly doubling the EBITDA. So it's a financially transformative value proposition to the clients. And oh, by the way, by freeing up their time, allowing them to see more patients, access to care starts to improve. Second, now because they have time to prepare for these patient visits, they can be more engaged during these patient visits, they can actually start improving the quality of care, and as well as being proactive with patients, they can reduce cost of care because now they're preventing the patients from their disease state.